Dr. P asked me what my reasons for quitting smoking were.
So, Joe, you said you wanted to quit smoking. Why?
Well,
it appears that your heart and lungs have been affected by smoking, and if you don't quit now, you'll be toast, toast, toast.
my health. I'm in hospital because of my smoking. My heart, my lungs.
You are correct.
Do you have any other reasons to quit smoking?
Well, there's the money.
You are correct.
Do you have any other reasons to quit smoking?
Joe, I'm so glad you're okay.
Way to go, Joe.
How you doing, Joe? Good job.
Hey, Joe. Nice work.
Hi, you look fantastic. Hey, Joe, it's good to see you.
Aw, isn't that special? Exercise number 2, identify your personal reasons for quitting smoking.
Pause this now and press play when you've finished your list.
Health, which includes better energy, better breathing, improved circulation, and improved taste and smell. Financial reasons, family and friends, to name a few.
Dr. Poteryko taught me that quitting smoking is a skill, like learning to ride a bike.
Millions of people have learned how to do it, and so can you, Joe. Just like learning how to ride a bike, it's a great accomplishment. But remember, if you make a mistake and fall off the bike, you wouldn't give up. You'd brush yourself off and get back on.
My motivation was growing, and I was feeling something else, a bit of confidence. I was starting to think that maybe I could quit.
So in the cessation clinic, we say that you are becoming a non-smoker again. First, we say again because no matter how young or old you were when you first started smoking, you were once a non-smoker before that. We say non-smoker to help with this healthy behavior change. Quick, Joe, don't think of a pink elephant. Don't think of it. Don't think of a pink elephant. Our brains want to think of the pink elephant before we cannot think of it. Quitting or stopping smoking are negative phrases too. No one likes a quitter. It's easier to state the desired behavior in the positive. Thus, become a non-smoker again. You with me, Joe? Aren't you? To simplify, it's easier to move towards something rather than away from it. You future non-smoker, you.
Behavior change, I think Dr. P called it. Then get this. Smoking, this habit that I've had for 20 years, is just an illusion.
In the clinic, we use the statement, smoking is an illusion. You may doubt this statement, but you also might see some truth in it. Tobacco addiction merely digs a hole for you without you realizing it. In order to relieve stress or feel relaxed, you use tobacco to get this effect. A non-smoker starts off at level ground and doesn't need a cigarette to catch up or feel normal. You dig? It's sort of like banging your thumb with a hammer. So when you light up a cigarette, you stop banging. But when the cigarette is gone, it only takes minutes before the banging begins again. So another example would be that if you were wearing shoes that were 2 sizes too tight all day long. At the end of the day, when you take them off, you feel relief. In both cases, there is apparent relief, but it's short-lived. Before long, the addiction has you needing another cigarette to feel normal again. Hence, the illusion.
How was it giving up smoking? Well, really, it was nothing. I just had to learn that first.
Any questions so far, Joe?
Nope, nothing yet, Doc.
Ah, you must have read my mind, because now we're going to talk about nothing.
Nothing?
Yes, nothing. Let me put it to you this way. So clinic patients sometimes tell me that smoking is like their best friend. It's there in good times, it's there in bad, it doesn't talk back, and it gives them what they need. But what best friend takes your money and shortens your life? On average, 10 years. So is that your best friend or your worst enemy? That's the illusion of tobacco.
So I had nothing to lose and everything to gain back.
Whether it's better health, money, more confidence, or even more time, by losing this addiction you can only gain.
Thanks, what's this?
That's what we say in the clinic, Joe. Smoking is an illusion. I'm giving up nothing. I'm gaining everything back.
But just because I had a new insight and a new understanding, it didn't mean it was going to be easy.
Becoming a non-smoker does not have to be a fear-filled, death-defying experience. So quitting smoking can be right fun stuff. Hey team, bring in the cessation crash cart, stat! I've always wanted to say stat. As said, with the right approach, we can make this experience pleasant. Would you like some whipped cream with that?
Sure.
How about some cinnamon?
Of course.
Thanks, team. Now, our hospital band has something to say about medications for smoking cessation.